Hello everyone! Welcome back to my channel. For those of you who are new to my channel, I'm Dr. Chris Erica, and I'm a practicing pharmacist who's passionate about evidence-based medicine and in preventative medicine. That is, getting vaccinations. So because I'm part of the Phase 1 group in the vaccine rollout here in Ontario, I was able to get my first COVID shot earlier last week, and in this video, I want to share with you my rationale as to why I decided to get the shot as soon as they offered it to me. I also want to take this opportunity to address some of the concerns that I've been hearing about COVID-19 vaccines lately to hopefully convince you to get the shot as soon as it's offered to you. So here's just a brief overview of the three phases that Ontario has in terms of who's in which phase of the vaccine rollout. So it's just a rough estimate, and timeline will change depending on the vaccine supply. If you want to find out which phase you're in, go to your local public health website for more details. So let's answer the question, to get or not to get the COVID-19 vaccine. For those of you who know me personally, I always take the time to think about things before making a decision. So whenever you're given or prescribed or offered a medication or a vaccine, you always want to weigh the pros and cons of getting it or taking the medication. Let's go over my own pros and cons of getting the COVID-19 vaccine. Now, because I'm a healthcare provider who provide care to patients directly, I'm actually at risk of contracting COVID-19 for patients who come into the pharmacy. So by getting the vaccine, I'm reducing my risk of getting COVID in the first place. Or even if I do get it, by getting the vaccine, I'm reducing my risk of getting hospitalized, getting any severe COVID, or dying from COVID itself. Although the chance of me dying from COVID is probably really small, for those of you who know me, I don't like taking any chances. I want to be protected. By getting the COVID-19 vaccine, I'm reducing my risk of losing my own taste and smell. And this is something that can be long-term actually. And because I'm a food lover, losing my sense of taste and smell can be really depressing. So as a pharmacist, I'm actually required to be sharp all the time, and one of the long COVID symptoms that I'm really afraid to experience is this thing called brain fog, where you're not able to think, or you have difficulty thinking, you're always confused, and just can't concentrate. These are the reasons why getting the vaccine was a no-brainer for me. So here are my own cons from getting the COVID-19 vaccine. First of all, I hate needles, although it didn't really matter because if you've seen my first video about my experience about getting the COVID vaccine, it was actually painless. So I was really surprised about that and really happy so that, I wouldn't be dreading the second shot. So yeah, most vaccines require 2 doses, so you actually have to come back for it. So that's sort of the con. It's not a single shot unless you're getting the Johnson & Johnson vaccine. And here are some of the possible side effects that you may experience. So some of the common ones would be sore arms, so redness, swelling, and pain, which is very similar to any other vaccine really. You can get some fever, chills, headache, fatigue. Note that these usually last just a couple of days, so it's a short-term pain for long-term gain. In my first experience of the COVID shot, the only side effect that I experienced was sore arm. It was just a little bit painful to move the next day, but after that I was able to do my usual workout, so it was just like any other flu shot. So overall, based on my assessment and what I know about COVID-19, the benefits of getting the vaccine far outweigh the risks that are associated with it. It's very similar to medications that you take, whether it be over-the-counter or prescription. You take it because you, the doctor, and the pharmacist have judged that the benefits outweigh the risk of taking it. So who else should be getting the COVID-19 vaccine for sure? Besides the healthcare workers who interact with patients on a daily basis and other essential frontliners, patients who are at high risk of getting complications from COVID-19 should be vaccinated as well. These individuals include anyone who's over the age of 50. The risk of mortality or death is much higher with anyone who's over the age of 80. And we've seen that in our data as actually. Anyone who's male, obese, BMI of at least 30, anyone who has the following medical conditions. So heart disease, diabetes, respiratory disease, COPD, high blood pressure, cancer, and kidney disease. Please note that if you are pregnant or breastfeeding or have an autoimmune disease, talk to your doctor or your pharmacist to discuss your own pros and cons of getting the vaccine, as these populations were excluded in the study, which means we don't have a solid efficacy or safety data in this population yet, although there are some real world data in pregnancy already, specifically in Israel. So if you do live with someone who has any of those conditions that put them at high risk of complications from COVID-19, please consider getting vaccinated, because by getting vaccinated, you are reducing your risk of getting COVID itself, and by reducing the chance of getting COVID, that means you're actually reducing the chance of giving it to them. So moving on to the concerns that I've been hearing about COVID-19 vaccines, specifically with mRNA vaccines. So number one, mRNA vaccine technology is just too new. This is actually false because mRNA technology has been there for a while. In fact, both Pfizer and Moderna have been working on mRNA or on mini projects that involve mRNA technology for a while. So as soon as they found out about the genetic material of the spike protein in COVID, they were able to upscale the process and start the clinical trials very quickly. So to learn more about how mRNA vaccines work, this is actually a good infographic from the University of Waterloo, my alma mater. And of course, if you have any other further questions, you can ask me in the comment or ask your pharmacist. I also want to mention here that vaccine-induced immunity is way better than natural immunity. Because with natural immunity, people will actually die. And the risk of severe illness and death from COVID-19 far outweigh any benefits from natural immunity. Moreover, we know that natural immunity doesn't last as long as vaccine-induced immunity. And we've seen that with reinfections. We've seen reinfections just after a couple of months with natural immunity. So hierarchy of vaccines, we can't really compare the vaccines apples to apples because each of them were done in different settings, different timeline, different population, different countries. As a matter of fact, Pfizer and Moderna were done even before the variants emerged. So for you to compare the efficacy rates from Pfizer and Moderna versus that of the Johnson & Johnson and AstraZeneca is completely irrelevant and useless. What we do know for sure is that the ones that are approved by Health Canada are all very effective in preventing death from COVID, hospitalization, and severe COVID. Which is the main reason for our lockdowns in the first place. We don't want to overwhelm the healthcare system. So by getting the vaccine, we're reducing the risk of hospitalizations and complications from COVID. As a matter of fact, the number of cases who died from COVID that actually got the vaccine, regardless if it was the mRNA vaccine or not, was actually zero. No. So in summary, the best vaccine is actually the one that's administered in your arm. Another issue that I've been hearing a lot about actually is the lack of long-term safety data in in COVID-19 vaccines. While it's true that we don't have years of safety data from the vaccine, the mRNA vaccines themselves, they actually get degraded days after getting the vaccine. So it's gone in your body after like just a couple of days or so. The likelihood of it causing any long-term effects or side effects is very, very small, minuscule. Furthermore, the longer we wait from the administration time to see any long-term effect, the more confining factors there are that cannot be attributed to the vaccine itself. So association does not equal causation. For example, if I take a medication today that has this unknown side effect of constipation, okay? And years later I got constipated. Does that mean does that automatically mean the medication I took today caused my constipation years later? Most likely not. There are other factors that can cause constipation. Age is a major factor. Sedentary lifestyle. Diet. So, and many more. But you get the idea. What we do know for sure is the long-term negative side effects from COVID-19. It's this thing we called long COVID that I mentioned briefly earlier in my video. While most people with COVID-19 recover to their normal health after weeks, some patients actually have symptoms that last for weeks and sometimes even months. And these happen to people who weren't even hospitalized or who just had a mild symptoms from COVID. So here's just the list of some of the commonly reported long-term symptoms from COVID. As you can see, there's the brain fog that I'm really concerned about. Other more serious long-term complications may include rash, hair loss, smell and taste problems, sleep issues, difficulty with concentration, and memory problems. So take your pick. Would you rather experience the known long-term negative effects from COVID-19 or take the risk of getting a potential unknown long-term effects from a vaccine that's likely not going to happen based on its mechanism of action and the ingredients in the vaccine? So in summary, getting the COVID-19 vaccine is one of the main tools that we can use to end this pandemic. Every pandemic has an ending, and the sooner that we achieve herd immunity, or at least 80% vaccination rate among people aged 16 or over, the sooner that we can end this pandemic. If you have any other questions or concerns, please don't hesitate to talk to your pharmacist. After all, we are the most accessible healthcare provider out there. Also, in this month of March, please take the time to thank and appreciate your pharmacist as part of the Pharmacist Appreciation Month. Thanks for listening.